We are back from our break for our third presentation segment here this morning. We've a lot of different perspectives on childbirth and maternity, and I think we can all agree that no matter what, childbirth is something that no one wants to go through alone, and no one should have to. And it's fantastic that these next presenters are here with us to explain the role that has existed for, frankly, hundreds of years, if not more, to help women through this most challenging and miraculous time that they go through, the time of childbirth, the role of the doula. And today we have two tremendous presenters here with us today. I want you to lend your ears to both Kimberly Porter and Rabin Nolan. They are the co-founders of the Community Doula Alliance, and they're going to walk us through quite a bit of good information about the role of the doula, and in particular, how that role can make a huge difference in birth outcomes. Please welcome Kimberly Porter and Rabin Nolan.
Hello, I'm Kimberly Porter. I am the Executive Director and Co-founder of the Community Doula Alliance. I'm also an early childhood mental health consultant, child and family therapist. I'm also a certified labor and postpartum doula and a certified infant and health specialist. I also serve on 3 boards. I'm on the Oregon Doula Association as the Diverse Communities Development Board Chair. And I'm also on the Portland Doula Association as the Vice President and the Oregon Infant Mental Health Association, and I serve as the Diversity, Equity, and Inclusion Board Chair.
And hi, my name is Rabin Nolan. I am also co-founder of the Community Doula Alliance. I'm going to be program director. I also currently work at Birthing Way College, and for the past 3 years have been the doula trainer and educator there. For the past 7 have been the program coordinator for the doula programs. I'm also the current president of the Oregon Doula Association and co-founder, and I'm a certified labor and postpartum doula. I've been doing that since 2001. So we would love to talk to you today about doulas, and I think just so we're all on the same page here, stand it up. Some of you might be really familiar with what a doula is, and some of you, this might be kind of a new term, so we're just going to give you kind of a baseline. Doulas it's a traditional role that people have been doing since people have been having babies. But we're non-clinical, specially trained personal support companions, and our scope is that we provide physical, emotional, and informational support to clients, the birthing person, to their partners and their whole families throughout pregnancy, birth, and postpartum. So I want to talk to you a little bit about the different types of doulas. There's, it's not just you're a doula. The main 2 types of doulas as they are currently trained in North America are birth doulas and postpartum doulas. So birth doulas, that's probably the one that most people are familiar, like if they're familiar with doulas, they probably are more familiar with birth doulas. The care for that really focuses in on pregnancy and birth and a little bit postpartum. So, usually do 1 to 2 prenatal meetings with the family, really get their goals and values about what kind of support needs they have, maybe help them with the birth plan, maybe help them with some postpartum planning, providing information for informed choice. And then you're on call from usually 2 weeks before the birth, sometimes 3 weeks, sometimes a whole lot earlier, depending on what's going on with the client. I'm on call right now. So I could get called. I don't think I'm going to get called right now, but probably like 3 in the morning, I'll get a call. Hey, how you doing? All right, sounds like you're ready. And then I go to my client and start supporting them. So just kind of ready at a moment's notice. And that's often the hardest part for birth doulas too, if you were interested. And then doulas provide continuous labor and birth support. That's the difference between nurses at a hospital and doulas. One difference, nurses, are shifting on and off every 12 hours. Doulas are there for, the duration, whether it's a, quick 6-hour birth or a long 3-day induction. Doulas are in it for that whole time because it's that relational piece that is really valuable. And then after the baby's born, we stay for immediate postpartum, help with lactation support, and just kind of landing as a family, pictures and all that. And then, you know, doing 1 to 2 postpartum visits, maybe more if there's challenges with lactation or other challenges, but it usually is kind of a encapsulated period just of that crucial, like, birth window is where the birth doulas really come in. Postpartum doulas, maybe the less well-known doulas, but still, I think, really, really important. Oh wait, one other thing about birth doulas. Birth doulas are currently the only recognized traditional health worker type as a doula. We'll talk a little bit more about the THW process and what that is on the state level, but it's only birth doulas that are currently recognized. Around 3 months, but that is flexible. You know, if you have triplets, you probably could use postpartum support for a year, or if there's medical needs or things like that. But, you know, it's really specializing on infant care, mother care, healing, recovering, sleep, in-home support. Yeah, lots of breastfeeding support if that's what the client's goals are. Lots of just lactation support, because we know that the data on that people are most likely to succeed breastfeeding if they are supported by their partner and supported by the people around them and have, you know, access to just information and encouragement and support to continue on. Doulas might do really short shifts of just, you know, 2 to 3 hours in home, providing a lot of that practical support, or you might do an overnight shift with the client. Some people just need 1 or 2 visits a week. Some people have postpartum doulas, you know, much more frequently depending on their needs. So they're really valuable for that. Just landing as parents, establishing breastfeeding, establishing bonding before everybody goes back to work, just really getting in a good group there. And then I also want to introduce you to the idea of community-based doulas. This is something we're both really passionate about. When you look at the research on doulas, specifically birth doulas, and how they, you know, reduce a lot of health disparities, they reduce a lot of interventions. A lot of the research with the best health disparity outcomes is actually community-based doulas that have they usually have both. They're trained as both birth doulas and postpartum doulas, so they have those skills. And then they provide a greater degree of like wraparound support. So instead of, you know, 2 prenatals and 2 postpartum visits, they might do like half a dozen prenatals or postpartum visits for the first 6 to 9 months, just to check in and make sure the family is still on track. Another really important part of what community-based doulas, like how they are essentially defined, is that community-based doulas identify as a member of the community they serve. So that's not just like, oh, I'm willing to help that community. It's like, I am a member of that community. That might, you know, look like racial, ethnic, linguistic, religious, LGBTQ. It could also be lived experience, like we have with peers, like addictions, homelessness, domestic violence, intimate partner violence, teen pregnancy, refugee, military. We could go on and on, but the key is that I'm supporting you and we have this shared experience. We have this shared connection. And that's what's really going to get a lot more mileage than just, I'm some random person that's nice, but doesn't really get your situation, you know? So that's just a really key part of community-based doulas and kind of what we're all about. And you might have heard there's a few other types of doulas, like people will say I'm a full spectrum doula. So that would encompass more like from preconception to abortion and loss through, you know, and including birth. There's full circle doulas. That's like a brand of, you know, labor, more extended, like birth doula through postpartum. So it's kind of more of that full circle of care. There are doulas who specialize specifically in supporting perinatal bereavement and loss. There's doulas. Yeah, there's even a category called death doulas. That's sort of a separate, like not even associated with, you know, infants and mothers, but more on the other end of the spectrum with end of life care. So I have a friend who's a death doula who works at OHSU providing palliative care for people at the end of life. So it's that non-clinical supportive care, providing physical and emotional support that is kind of that theme that winds throughout. But we're going to be focusing mostly on these main types of doulas. So one of the questions is, how are doulas employed? Doulas are kind of a unique creature in healthcare. They're often very separate from the healthcare system historically. So this data is from the Oregon Doulas Association did a workforce assessment in 2018, and we surveyed doulas throughout the state. I linked the resource at the end of the slide deck if you want to read that. But yeah, so I just wanted to kind of point out that the vast majority of doulas, their work is as self-employed doulas. So the client hires a doula, the client usually pays out of pocket, the doula works for them, not for the hospital or for wherever they're birthing. There's also doulas who work for an agency or who are both agency and self-employed. There's, you know, a small portion of on our chart here is hospital employed doulas. This chart represents how, if you took all of the doulas, how they are employed. But if you were to shift the chart of like all of the births done, a larger majority would be done probably by hospital employed, agency, and self-employed doulas. There's also doulas who work as volunteers, either just like I am the doula for my friend, or just for people in my community that I know, like word gets around, and so I just do it for free because I love this work and I want to support my community, or doulas who volunteer through a formal organization. Like we have a couple in Portland, like PDX doulas or Gateway doulas. Gives people an opportunity to often like get a start and gain experience as doulas. There's also doulas who are employed through a community-based doula organization, or just a community-based organization as doulas. So we'll be talking a little bit later about some of those models and what that has looked like, especially in our area. But I wanted to give you some context here. Okay. So you heard me talk, you just mentioned briefly about traditional health worker registry. So I wanted to just give you, if you weren't familiar, just a really brief history of doulas and Medicaid reimbursement. Doulas have historically not been involved in any of this at all. Doulas are kind of, you know, completely on their own. They're the lone cowboy out on the range, but yeah, they're not usually able to bill Medicaid. They're not state or federally regulated. They're all just certified through their various organizations. But we know that doulas can make a big difference in improving birth outcomes. And as Oregon started looking at how they could change their own numbers, they introduced House Bill 3311 in 2011 to just investigate, like, oh, should we use doulas? Like, what would that look like? They did some research, and the subsequent report said, yeah, we should utilize doulas. They can improve birth outcomes, and they should be reimbursed by Medicaid. At that time, it was groundbreaking. There was no other state in the US that had really, I mean, there were others that were kind of on a similar path, like looking, but nobody had really passed that legislation saying doulas should now be reimbursed by Medicaid. But it was still very vague as like, how, what does that process look like? So in 2013, House Bill 3407 also established the Traditional Health Worker Commission and Registry. And then there's multiple worker types under there. There's community health workers, peers, health navigators, and birth doulas. Kind of the unifying factor for that is that all of those are non-licensed, non-clinical health workers, aimed at specific populations. So doulas were kind of put under that umbrella with these other groups that we didn't really, a lot of doulas were like, oh, what is a peer? We don't know. So it was kind of new there for us too. During this time, the Medicaid reimbursement rate for doula support was only $75. So think back to what I told you about how birth doulas, how their services work. You do multiple prenatal meetings with a client through their pregnancy, and then you're on call, and maybe you're on call for like a month for that client. That means you can't leave town. That means you have your phone with you all the time. That means you can't drink. You're always well rested and ready to go. And it's challenging. And then, you support them through their birth, and maybe that's short, or maybe it's like 3 days, but you're in it because you're committed to the work. And most birth doulas, another finding that we had from the workforce assessment, the average birth doula really they max out around 3 to 4 births a month. So that's, the total amount of clients that an average doula could serve, their capacity kind of hits at 3 to 4 clients. So you can imagine that $75 for that didn't fly real well. But it was a start. It was Medicaid trying to get there. In 2017, the rate was raised to $350. That was much better and much appreciated, but it was still not a sustainable rate for doulas to, pay their rent, buy their groceries on any level. From 2017 to now, doulas were trying to figure out, like, how can we do this billing process? Like, what does this entail? How do we get on the registry? But the billing process was not super successful. And then in 2020, with all of the things going on, there has been an increased awareness from, OHP, Medicaid health plans, that there is a need to enhance that fee-for-service, like bundled rate. We have low doula attendance for this, so it's understood now that rate needs to be higher. So I want to talk for a second about some of the challenges, barriers, and successes, if we can see that on the screen, which you can probably see coming. So the traditional health worker registry, as doulas have kind of historically been the boss of themselves, they're self-employed, and then suddenly the registry's like, oh, we want you to document all these things, and it's pretty reasonable. But there has been challenges just getting the required continuing education, having the right documentation, knowing who to turn it into. The low reimbursement rate obviously was a huge barrier. People not really interested in trying that hard if they're only going to get $75 or $350. And then the difficulty billing. So even we did have a few doulas who managed to get on the registry, and then they, were like, how do I bill this? What form do I use? What code do I use? How do we even figure any of this out? And doulas talk. And so once that got out, there was really low doula engagement, because people were like, well, good try, Oregon. I don't have the time to do that. Like, it's easier for me to just volunteer for births in my community than to jump through all of these hoops to do that. So when you look at the traditional health worker registry, there are thousands of community health workers. There are thousands of peers, of different types of peers. There's, I haven't looked very recently, but there's less than 100 doulas. Mostly it's been less than like 40 or 50 doulas. So pretty low doula engagement, which has been disheartening. So those are kind of some of the challenges and barriers, but there have been successes more recently between the traditional health worker registry folks and the doulas and the Oregon Doula Association working together. We've kind of invented the concept of doula hubs, where instead of a doula just trying to figure it out on her own how to bill, that they can connect with a hub that will help and, provide support for that billing. Historically, there's been all these requirements to get on the THW registry, and they haven't been offered. Like, training organizations are not motivated to offer these because not many people are, demanding them. But that's changing. We're slowly building more resources so that doulas can meet those registry requirements and get on the registry. Also, more recently, there's been just CCOs have been more tuned into doulas and, really hearing us saying like the fees are not enough. And so several of them are, have plans to enhance the fee for service rate to greater support access and more sustainability. So those are some encouraging things. We're not there yet, but it's a trajectory, right? So that is my part, and then I think Kimberly is I want you to talk about the next parts.
So as we stated, thank you, Raven, for giving a comprehensive overview of what doulas are and also how doulas are getting reimbursed. But we really want to talk about what is the real problem. So as we talk about maternal inequities, the United States has the worst overall maternal and infant mortality and outcomes in developed nations. So we really need to take a look at that from a medical lens. What does that look like? And we look at the statistics. We're seeing that the Black maternal mortality is 3 times higher than whites. So that means that Black women are having a difficult time surviving after they give birth. And that rate is 3 times higher than it is for white, for basically white pregnant people. And so we're also seeing with the Native American community that they're more than twice as high as whites. So we're really looking at those particular communities, the African American community and the Native American community. There's disparities specifically in those communities. And so when we look at the infant mortality rate, which means that, our Black babies are having a difficult time making it through their first year of life, that mortality rate is double that of the white infant mortality rate. And then we're also seeing that Black babies are more likely to be born preterm and low birth weight. And so I kind of wanted to talk a little bit about that. So since we are talking about, health, this is really around health inequities, we really wanted to focus on those 2 particular communities, which are the African American and then also the Native American. And we're starting to see some trends with the African community as well. So just like I said before, I am on the Oregon Doula Association. So my mission and vision has been, as a Black doula, to be able to address some of these inequities and make sure there's a workforce of doulas, particularly Black and Native American, that can address these disparities. So we really wanted to take a look at, like I said, because of statistics, we're seeing a higher rate of infant mortality rate and maternal mortality rate in the Black community. We need to have more Black doulas to be able to serve that community, so we see a cultural match. So that's what we're seeing to see the change. So we don't want to stay, we see the problem, you always hear the problem, but yes, we understand what the problem is, but our solution is to stay centered in the solution and not stay stuck on the problem.
So as we're thinking about how to bring more doulas into this work, and particularly Black doulas, we also need to think of how we're going to integrate them into the maternity care team. Historically, doulas have just been kind of, on their own free agents, but if we're really going to make this work, there needs to be a greater level of integration in the hospital systems and in the healthcare team. So there's been, several, when we talk about doulas in general, like that they should be a member of the maternity care team. Part of that looks like basically allowing doulas into the hospital. So I know we're in COVID and it's totally reasonable that we have these restrictions to support everybody's safety and first responders' safety, but it has also been very challenging with clients who were anticipating having this important doula support, and then they have those limits that the doula is not allowed to come in. So over the summer, about half of the hospitals in Portland have started to open up and allow doulas again. but it's real hit and miss, and the guy at the front door doesn't always know to let doulas in. Policies are not clear. Different care providers are telling people different things. And so just having the national standard be that doulas are a legitimate part of the maternity care team and should be allowed to come in and support their clients. Another thing that happens is often doulas are there for the birth, but then when a significant intervention such as an epidural or a cesarean is going to happen, the doulas are asked to leave. The doulas are very helpful in those things. And so it is super beneficial for the client to be able to have their doula who's been with them for this 3-day induction to be present in the cesarean also, to help with just remaining calm. I've held vomit bags in cesareans. Like, there's still a lot that the doula can do, even if you're not moving around the room or helping with a lot more physical support. But yeah, just being really present, helping with skin to skin, helping with that first meeting. You know, meeting your baby is so precious, and to have support and not worry that you can't, you know, hold the baby because of your surgery. So having a doula in those super common interventions is another part of being a part of the maternity care team. Another piece of that looks like is being more included in social worker case management, like in strategies and communication. I was contacted through Birthing Way. I helped support the student doulas there. So a social worker contacted us and said, I have a single mother who's fleeing a domestic violence situation. She needs doula support. So we got her 2 doulas to help walk her through the end of her pregnancy and support her during the birth. But, you know, right before she was due, she just went off the radar. And the doulas couldn't get a hold of her, and the mom had been talking about getting back together with her partner or letting him know. So they were very concerned. So they were able to communicate with the social worker, and between all of them, they were able to get a hold of the client or the mom. Her phone had broke. So they got a hold of her through different communication ways. The social worker from their end was able to kind of talk to them about, you know, not getting back together with their partner. The doulas were in contact with her, helped her through her birth. And that was just a really like well-rounded support, instead of just the doula, you know, isn't connected to all those other pieces. It's so important. And then the last one, just professionalism within the maternity care team. I think Portland and Oregon in general is a very good model for how doulas can interact with care providers in maybe other parts of the country, or maybe, I don't know, when you watch doulas on like the Mindy Project or something, they're always like a bunch of hippies that are just out to fight the doctors or something. That's not how I train doulas. That's not how doulas are supposed to behave. They're supposed to be a functional part and participant in that team. And the care providers are able to work with them and not be like, oh, your doula is probably telling you not to, you know, get an epidural. As a doula, I'm like, no, I can see why that is reasonable, and let's talk about the pros and cons. So just having like a good working relationship is very important, and I think we've done a good job in Oregon of that, and that's just another piece of that integration of doulas.
I also just want to add, because, you know, like we were talking about, you know, in order to create the balance in terms of Black doulas, I also, you know, we're in COVID times. So because we're looking at a lot of these Black families having a really difficult time, you know, with their birth outcomes, a lot of the doulas that I've, you know, really mentored and supported is that they can do virtual support. So even though those like Lillian, I mean, even though she wasn't able to come into the hospital to serve this family in a doula capacity, she was able to be there as an interpreter, but she's interpreting doula support. And so we need to really want to take a look at that, is that even though these doulas, because they know it's so critical, that those families are really at risk if they're going into the hospitals and they don't feel supported, they need to still have that support. So it's usually been through FaceTime, or it's been through a phone call, or now, you know, they're getting coaching from, you know, Raven and I doing that process, because we do train and mentor doulas. And so those, I want to just emphasize, those Black doulas are still serving those families, even though they're not physically allowed to be in the hospital, or if they're not other traditional health worker types, like an interpreter. So they're still on the front lines. And I also want to add to the social worker case management strategy, a lot of the community-based organizations, that they know that there is, a lot of them are aware of the cultural match and how important it is to have that. They will reach out to a community-based organization like they did the Black Parent Initiative when I was the director there, to be able to say, hey, I have this particular person has these medical concerns, and so I know that's going to compromise their pregnancy, so can you support? So there's their additional kind of support. But I just wanted to say that the hospital social workers are linking to other community-based organizations that actually provide doula services, and that's been really helpful. So just, really emphasizing that, because of a lot of the challenges that these Black and Native American pregnant people face, they need additional support. So we can't allow COVID to interfere with that. We also have to continue to make sure that we're real supporting them in any way possible. And so that's really been virtual support. So now I want to talk about, Raven talked a little bit about traditional health workers and community-based doulas. So what we have looked at, in terms of the birth community, is that we need more birth advocates for underserved and marginalized communities. The word marginalized and underserved, a lot of times is talking about, the communities of color, African American community and the Native American community in particular. So in order to be able to address those disparities and inequities, we need to have a more diverse workforce. But what we're seeing is that, like, Raven has shared, there's about 100 doulas that are actually on the registry, but these specific communities are having some limitations. And so obviously, because of the fee was really low, or they don't have someone to walk them through the process to be able to, have them fill out their application properly. There's a lot of things that's a barrier to these particular doulas doulas that serve these underserved and marginalized communities are actually somebody walking them through the process. And so what we've also seen is that we have a lot of doulas that have been trained as doulas, but they need additional training to address some of these inequities and some of these disparities. And I'll talk a little bit about that as we talk about community doulas. So we need a robust community-based doula care with more wraparound support. So Raven, talked about, we have this kind of community-based model where these are doulas that have a lived experience of the families that they're serving. So we need it needs to be like a full circle model where those doulas are trained as labor doulas, because we're addressing some of those disparities. A lot of Black women are having a lot of different factors that are making it difficult for them to have a healthy pregnancy, but also a healthy delivery. And so we're looking at, there's high rates of diabetes, high rates of high blood pressure, preeclampsia, all the different things that compromise their ability to have a healthy pregnancy. And so that's why having a community model is very important, because those doulas that are considered community-based doulas, they have a broad range of specialized training as a labor and a postpartum doula. And so we want to, those doulas need to be able to work with those pregnant people really early in their pregnancy, because if they do have medical complications, doulas want to be able to, those community-based doulas want to be able to support them early in their pregnancy. If it's a nutrition issue, if they need to be able to manage their diabetes, if they have high blood pressure, which is definitely stress-related, particularly in the Black community. I'll talk a little bit about that a little bit more. So we need not only the doula staying within their scope as a doula, but we also need other social services to be able to wrap around that family if stress can be related to not being able to pay your rent, not being able to have a job, maybe you're in school, maybe you have other children. So it's just not just a community model, the community doula, but we also need the doula to be able to provide, or at least link them and coordinate other services that are needed. So we also talked about the value of cross training. So what I've noticed, as being a doula for 6 years, primarily working in community-based organizations and working with doulas of color, the ideal doula, all doulas, folks can be trained, but what we're seeing is that we want to recruit more community health workers. Those community health workers do have a lived experience of the families that they're serving. There's a cultural match. We're looking for folks that are already in the social service world, because they have a really clear understanding of some of the issues that are going to come up, some of the environmental stressors, some of the social determinants of health. And so those, we already want someone that kind of have a framework of what that looks like. So they are helping these families navigate and mitigate some of these other stressors. So peers, someone that's actually maybe had a doula, so they can, have a better understanding because they've had an experience. Interpreters, like I said, there's a gap there because we want doulas. There are lots of our families linguistically, like Reagan talked about a little bit, that English may not be their first language. So we want folks that are already trained as interpreters, that are bilingual, that can be like a liaison between their medical provider, their maternity care team, and then also themselves. So they're making sure they're getting the proper information. So if there is a prescription that needs to be filled, if there's some type of medical advice that's given, they understand it in their language and they're more likely to comply with what the doctors are saying. Also social workers. I'm a social worker as well. So definitely coming from a social justice lens. That's kind of what, we're looking for. And then also public health workers. The infant mortality rate, particularly in the Black community and the Native American community, is a public health crisis. And that's why, we're so excited about being able to do this presentation. And so public health workers are also folks that we're recruiting as well to be doulas because they understand that a doula is an intervention to address its health inequities as relates to pregnancy and birth outcomes. So like I said, we don't, as a doula, that really wants to address the inequities and disparities, we want to focus on solutions because we know that there is challenges. And so we really want to focus on the solution. So we wanted to present one of our doulas who Raven and I have worked very closely with, and we consider this a case study to look at some of the challenges and successes of community-based doulas. So we have Lillian Olero. She is from Kenya. And she is a community health worker, and she works with the African Family Holistic Health Organization. So primarily she works, I guess, more in a community health worker lens, but definitely a social worker doing case management. So she works with African refugees and immigrants. And so she's bilingual, and she is also an interpreter, which is also a traditional health worker type, so she's bilingual. So a lot of the families that she's working with, or the pregnant people that she's working with, do speak Swahili. And she's also a traditional health worker. And kind of Raven talked a little bit about some of the limitations or challenges. And I'll talk a little bit about community-based organization actually helped her get on the registry, because that is also, a barrier, is having someone to walk you through the process. And that's why you don't have, you could have more doulas on a traditional health worker registry, because if they were supported and kind of walk through the process. And so Lillian we were able to assist her in walking through the process. And she's also a community-based doula, and she also owns her own private doula business called Pinda La Mama Doula Services. So this is a great case example of if you have, you have a doula who is working with one of the underserved communities, which is the refugees, and she's bilingual, and so she's able to connect with her community, and they trust what she has to say. So she definitely has really a triple. She's like a triple threat with all the different roles that she plays to be able to serve her community in a way that maybe someone else might not be able to serve. So that's definitely a success, and we're very proud of Lillian and her work, and being able to kind of just jump in and just do her work with her community. Her community highly respects her. But I want to say, as we talk about health inequities, like I said, with the African American community, they have the highest infant and maternal mortality rate. But like I said, Lillian is from Kenya, so she is working with refugees. And so, as we talk about kind of an unfortunate situation that came up back in July, Lillian shared with us that one of her mothers died. And so, that's a big issue, particularly for community-based doulas, particularly African American doulas that are working with families of color. I just kind of wanted to share with you the story. So this mom passed away, or she died 2 months postpartum. And so this is a family of 6, married couple from the Congo, living in a refugee camp. They have 6 healthy births, but they come to America, and their 7th child they give birth to, and the mom dies 2 months later. And that is because, like I said, we were looking at, these inequities. it's not that race is a factor, it's racism is a factor. And so a lot of times these Black women are not being listened to by their medical provider. I mean, I'm sure y'all have heard stories about Serena Williams with her blood clots and she knew her body. So this is a common narrative that you're hearing a lot with African-American women, where their maternal care team is not really supporting them and listening. And so a community-based doula, particularly one that has a lived experience as a person that they're serving, they're not there to speak for the family. They're there to encourage the family to speak for themselves, to be able to say, you know, I am going through something. I think there's something medically going on. And so this kind of talks back to the story that I shared about with Lillian. The mother that passed away, she talked to her medical team and she said, there's something going on. I'm retaining fluid. I'm not sure what's going on. And so she wasn't, I mean, she was listened to, but, you know, they did a lot of medical tests. They couldn't find anything that was going on. And then they found out later that she was, you know, undiagnosed and she did have cancer. But this was something that they didn't know until much later. And so, you know, I just kind of want to say Lillian was there to support this family as a labor doula, as a postpartum doula, even though during this time it was, you know, as we are still in COVID, but she was able to do virtual support. But when it was time for this mother to go into labor, she was, you know, able to have Lillian there, at least as an interpreter in Swahili. So this is a really good example of when you invest in doulas and when you invest in community-based doulas in particular, this is what that can look like. So we do see, yes, we are seeing disparities, particularly, like I said, in the Black community and the Native American community, but we're also seeing success. And Lillian is a really good example of having to be, you know, that type where she's an interpreter, she's a community health worker, and she's a, you know, traditional health worker, and she's a doula. And her community respects her highly, and they are going to trust her judgment when they go in to have their babies.
And another aspect that I recall from her story is just how wraparound her care was. It wasn't just 2 postpartum visits and she was done. She helped take her to doctor's appointments afterwards to try to figure out what was going on. So she had that community health worker, the interpreter, the doula piece, kind of all together to give a much more supportive care. Even though the outcome was still not good for this mom, I think that wraparound care is just crucial to what this model really should look like and really can look like as we build kind of these super doulas.
And I also want to say, you know, as we're talking about, you know, these community doulas being on the front line of we're actually addressing some of these inequities and disparities, we also have to wrap around the doula. And so when Lillian shared this with us, because she's a part of, I would say, an alliance of other community-based doulas, she was able to share with us her story. So yes, we're doulas, we provide physical and emotional support, but we're also providing emotional support to other doulas. And so when Lillian shared that with me, you know, I took that upon myself and I said, we need to do a fundraiser. Can you imagine a person that's been here, you know, for a couple months and they lose their wife and they're, you know, kind of with 7 children? And so I said, we need to do something to wrap around this family. So I basically did a GoFundMe on Facebook, and we were able to raise over $8,000 that I was able to give to this family outside of other resources. So they, you know, it's going to be a lot for this family. And it's, yeah, I just kind of recall when I went to go see the family and I met all of the children, and the 4-year-old was holding the cell phone because he thinks his mom's going to call. And so, you know, just kind of what that looks like. But I just wanted to really emphasize the fact that, yes, these are doulas who are actually helpers, but they also need that type of support as well, especially if they have a lived experience of the families that they're serving. So they need to have that support in their network to be able to help them continue to do this work. So I want to give you an idea of kind of some of the other examples of, you know, a CCO, which is a community care organization, and a CBO, which is a community-based organization. And so these are some of the models that we have seen that have been successful. I just kind of want to give you an overview of kind of what I bring to this work. Prior to becoming the executive director and co-founder of the Community Doula Alliance, I worked at the Black Parent Initiative, which is a culture-specific parent education program. So but before that, I was a home visiting manager. So I worked closely with the home visitors, which, you know, most of the families that we saw were African and African American. So they were coming in, you know, like I said, getting parent education, but they also had a lot of other environmental stressors, like we were helping them get their high school diploma or their GED or housing or any type of resources and things like that. So I continue to hear this theme with these Black women, honestly, that they were having difficulties with their pregnancies. They weren't feeling like they were being supported, or they didn't know how to access certain services, or maybe they, you know, didn't understand what their OBGYN or their midwife was communicating to them to help them with some of the other medical concerns that they had. So I had access. So what I'm trying to say is I had access to a lot of pregnant women, and so I decided that, again, with my social work or social justice lens, I wanted to address the issue and center around the solution and not just focus on the problem. So I decided to become trained as a doula back in 2014. I did my training, very culturally specific, because I knew I wanted to work with, you know, the community that I was working at the Black Parent Initiative. And so became trained as a doula, you know, did various trainings, went through birthing way as a postpartum doula, and was able to bring that back. So I went and having that skill set, you know, as a social worker, as a manager, as a home visitor, to be able to specifically work with these, you know, these Black families. And so over the course of a year, I was able to see 12 families. And so I was able to see, you know, improvement in their birth outcomes. I have never seen a C-section. Every family that I've ever supported, I think I've had like maybe 35 births in the short time that I've been a doula. And I have supported, most of my clientele have been African-American as a full circle labor and postpartum doula. And so I wanted to bring that model back to the Black Parent Initiative, even though I was doing that outside of my, you know, work at the Black Parent Initiative. And so back in 2017, a former CCO, Family Care, reached out to the Black Parent Initiative, and we decided to come up with a program to be able to, so I'm the co-founder and the visionary of the Sacred Roots Doula program. And so we decided that we wanted to be able to address all these disparities that we talked about earlier in the presentation. And so I said, what we really need to look at is that we can't just look at providing the services, which is, you know, the kind of the package, the postpartum, the prenatal, there's something, the doula providing, supporting the family through prenatal visits, labor, delivery, and postpartum. But we also, there's a gap, there's a barrier, because you're not having enough Black doulas. And so we need to diversify the workforce, but we also need to provide the service. So the need is already there, but the demand is very high, but we don't have the means to meet the demand. And so that's why I was like, okay, so why don't you, you know, so Family Care supported us with a 2-year project. And as you know, Family Care dissolved, you know, a year later. But within that period of time, we were able to, you know, have funds to be able to train more doulas. And so all of our doulas, or all of our folks that wanted to be doulas, were trained over at Birthing Way. And so that's why you see Raven and I together. We've done a lot of work over the last 7 years of having more of a cross-racial training. Because again, if someone has a lived experience, you're going to feel more comfortable. So you're having Black doulas that are going to, you know, an agency where they probably are a training doula organization, they might not feel as comfortable, but because I have this relationship and partnership with Raven, they felt very comfortable and they trusted me because they know I had done the work as a doula. And so, you know, we had a contract, like I said, it was a 2-year project. And so we were offering 4 prenatals, because we're looking at the frequency and the intensity. That was the minimum of 4 prenatal visits. The doula was there providing continuous labor and delivery support, and then also postpartum care. And so that was like maybe three postpartum visits. And so what we saw, I can't go into specific statistics, but what we saw is that there was an increase in initiation of breastfeeding with all of our families. We were between 85 and 95%. We saw a reduction in the C-section rate. And we saw, in terms of satisfaction, a lot of our families, majority, I would say 90% of our families felt highly supported by a doula. And so they felt like if you ask them, you know, with your next pregnancy, or would you recommend a doula to a friend, specifically a culture-specific doula, they said absolutely, because they felt like that person, that doula that looked like them, spoke their language, if there was a, you know, kind of a linguistic piece, that they felt highly supported. So that's the work that, you know, in terms of the Sacred Roots Doula program. And again, like I said, I already talked about the partnership that we have with Birthing Way. So I made sure, because again, some of the challenges that some of these Black families are having as they try to mitigate some of these systems, particularly in the hospital, they're also having challenges mitigating some of these organizations. So, like I said, because Raven and I both serve on the Oregon Doula Association, and we know that we want to address inequities, particularly health inequities, but we also want to create, like I said, my role on the, and we have the diverse communities leadership chair on the Oregon Doula Association. And so my primarily role, and I guess my mission in that role, has been to diversify the workforce. And so one of the ways that we're doing that is we have to train more people to be a doula, particularly Black and Native and Latino, Latinx doulas. And so those doulas, we receive money to be able, because that's another, we haven't talked a little bit about the barrier, is that there's a lot of folks that want to be a doula, but they can't afford the training. And so that's something that we needed to incorporate into that funding that we received from this particular CCO, is that we need to be able to provide training, to be able to pay Birthing Way to provide the training. And so we were able to do that as well. And so that we saw a lot of success with that. And so lastly, one of the other models, which is kind of going to take us into some of the things that we're doing right now, is that Birthing Way, and then, you know, me, Kimberly Porter Consulting was able to have a contract to have a doula business class specifically for Black, Native, Indigenous, and Latinx doulas. I also want to say Black, because what we're, like I said, because I shared earlier that we're seeing Black women, that's different than African women, because African women, when they come here to our country, they have had really well, they have had pretty good pregnancies and pretty good birth outcomes. But when they come here, because of all the, you know, all the other factors like racism and not being heard, not being listened to, a lot of the stressors that come along with kind of navigating racism and a lot of the medical concerns, we're starting to see those same disparities within the African community as well. So even though it's not there, I just want to make that distinction, but now they're kind of pretty much in the same category. So we do have, I mean, Lillian was one of our students that was in the class, and she is African as well. So in this class, it was over a year. So we had 2 cohorts, we graduated 20 students, 20 doulas that have already been trained as doulas. So we're kind of, you're seeing this on a continuum where you already have folks that are already on, doulas that are already on the registry. There's a cultural linguistic match. So they're definitely decided that once they understand the business model, that they want to be able to work with their community. So we have, you know, bilingual Spanish speaking doulas, like I said, Native American and Black, and like I said, one of them speaks Swahili. So, you know, teaching, I mean, really good business skills, because a lot of the trainings don't really go into much detail and give you a little bit of information, but we were able, Raven and I co-facilitated that business course, and specifically, you know, of course, how to set up your business, how to become an LLC, how to set up your contracts, how to be able to physically manage your business, but then particularly, specifically, how to be able to work with your community. How are you getting referrals? How are people getting to know you? How are you able to market your business? So, you know, one of our big missions is to be able to professionalize doula work. And so that's what we were able to do. So you now have a solid group of doulas of color that are able to, for other agencies or companies or CCOs or hospitals to partner with, to say, okay, this is a way that we can address some of these inequities and disparities, is that we can hire folks like Lillian. We can hire some of these Latinx doulas that are bilingual, that the community will feel comfortable working with in there. But then there's this partnership that these clinics or these particular hospitals that we know that this particular group of pregnant people are frequenting. And so we can have that, there's a referral source for those doulas to be able to provide community-based doula services to them. So what we're really excited about, you know, Raven and I and 2 other entrepreneur women have been working closely over the last 18 months. And so we're really excited to introduce the Community Doula Alliance. We are a nonprofit, and we're in the process of becoming a 501c3. So our mission is to be able to create a new generation of exceptional doulas that can address a lot of these disparities that we've been talking about. And we also, just the ever-changing needs of being a labor and postpartum person. And but we also want to make sure that we are highlighting BIPOC doulas. And so in this particular case, we are saying, you know, Black, Indigenous, and people of color, but there's a heavy focus on Black doulas, African doulas, Native, Indigenous doulas, and also Latino doulas. So we want to be able to shift the inequities by really looking at racial, you know, the racial linguistic community-based doula in particular. So yeah, we're relatively new. We're located, we do have a physical space, and we are up and running. And so we are really excited about this. So we have, the way it's situated, set up is that we're considered, you kind of see the link there. So we really want you to take a look at that after the presentation to kind of see some of the really awesome things that we're doing. And we're, the Portland Doula training. And so we have 2 programs. So I just kind of want to go back. We have 2 programs that we're actually focusing on. And I will start off with the Portland Doula training. So what we're going to do is we're going to offer training for folks that want to be a doula. So we're going to be offering labor training, postpartum, and then also how to be a community-based doula, because that takes a special skill set. And like, Raven has shared before, there's different types. There's community-based, there's labor, there's postpartum. And so we want to be able to really focus on how to train those folks that have already been trained as doulas, but specifically how to address some of these issues, which is going to take really understanding some of the factors, some of the medical conditions, some of the social factors, and helping these particular families of color, Black and Indigenous, navigate through these systems and how to be able to support them as it relates to stress and how stress can impact your pregnancy. How racism can impact your pregnancy, how to be able to be an advocate for yourself when you feel like you're not being heard. Those doulas are there to support them. There's other environmental factors, and I really didn't go into detail about that, but I think particularly in the Black community, postpartum care, we need to extend a little bit further. So even though at the Black Parent Initiative, when I was there, the program was really focused on 3-month postpartum, so maybe 2 or 3 postpartum support, postpartum visits, which really focusing on breastfeeding support, making sure, if there are any mental health issues or concerns that come up, because we do see that, because you are a member of a marginalized community, you may have to experience some sort of racism or some sort of stress, which if you do have a mental health diagnosis, it's going to exacerbate itself further in your pregnancy. So we want to make sure that those doulas have not like a therapist, lens, but definitely a basic understanding of postpartum symptomatology. So we want to be able to, have those doulas be able to at least briefly screen those families, because we know that that's going to compromise their ability to maybe attach and bond with their child, or maybe their breastfeeding and things like that. So we want to be able to extend that period of time. So that's going to be that specifically specialized training for those community-based doulas. We're going to be offering, like I said, a lot of other services, but then we also,
a part of it is that we're also going, like we talked about, the traditional health worker registry has these additional trainings that are so impossible to get. We want to bridge that gap and just make it a one-stop shop so that doulas can just, check that list off, get them completed, and get on the registry and be able to start offering services sooner instead of having to flounder for 1.5 years finding these trainings. So bridging that gap is also key.
Exactly. So an extensive array of training. So making sure that the doulas are heavily, like I said, exceptional, professional, highly skilled doulas. Another program that we have under Community Doula Alliance is a diverse doula project. Like I mentioned before, you have, basically support. I mean, these doulas are there to provide emotional support. And so when you're providing emotional support to people, you need somebody to support you as well. So this is going to be kind of like a space and a place for diverse doulas to be able to reclaim and celebrate their cultural and linguistic traditional pregnancy and postpartum rituals and things like that. So we want to make sure there's a space for those doulas to be able to do that. But we also, because they have this specialized skill set as racially, linguistically, community-based doulas, we also want folks to know who they are. And so when we get our website up and running, you'll have an opportunity to see all their beautiful faces and their bios and what the specific services that they offer. So that will be those 2 programs. And like I said, I mean, we talked a lot about the focus on BIPOC doulas. The research states that we're seeing better birth outcomes and an intervention. This is seeing community-based doulas, particularly those the ones that have a racial linguistic lens, are able to, it's just better for their family when there's a cultural match. So that's what the research is saying. And so we want to be able to support that effort to be able to have more doulas that are coming from these particular communities to address these disparities. But one of the things which I forgot to talk about was the training. So a way to have more diversity means you need to have more diverse trainers. And so one of the things that Raven and I have really talked about is, or really our other, just our kind of our brand, if you want to put it like that, is have a cross-racial training, because we know some things that may resonate to somebody may resonate differently to Raven. So we're definitely intentional and thoughtful about making sure that all of our instructors are going to kind of train dually, and so there are going to be 2 trainers that have a cross-racial presentation. And then also we want to be able to have trainings in people's native language. And so as we already talked about Lillian, we want her to be a trainer because she has a whole community of refugees and immigrants that are coming from African that their first language is not English. And so we know that that's going to make a difference in terms of, if we're looking at it from an intervention lens, that's going to make a difference. If you don't understand what your doctor is saying to you in your language, and you don't have somebody to translate that, you're probably not going to have a good birth outcome. So we want to make sure that our trainings are presented in a culturally appropriate linguistic way. So we are not only going to have our trainings, our labor doula, postpartum doula, all the community doula training in English, but we also want to, because we really did our own research and looking at the demographics in Portland of what's, one of the largest communities. And so we've noticed that we want to be able to have our trainings in Somali. We want to be able to have it in Spanish and then also Swahili. So, and that's a way to diversify the profession as well, to have more doulas, not only, and that's what I'm saying, the Community Doula Alliance, we want to have diversity at every level. And I just want to emphasize that it's just so important to have them at every level in our leadership, which you have me as a African-American doula, who is the executive director. And then we also have, diverse doulas on our board. And then we want them to be represented as instructors, and we also want them to be represented specifically in doing the work and have a cultural linguistic lens. Because of the Community Doula Alliance, I don't know if you all heard this saying before, but smart teams do amazing things, but diverse teams do impossible things. And that's what we want to do at the Community Doula Alliance, is make some, some dramatic changes in the birth community here in Portland.
Mm-hmm. One other piece that I would also add is thinking about the sustainability of these doulas. Doulas have a pretty high burnout rate, part of it because they're, solo on so many things. And a part of the Community Doula Alliance project, and especially the Diverse Doula Project, is to create a sustainable model so that the doulas have support. They are paid a living wage so that they can actually commit themselves to doing that work, to being on call. It's just so crucial that the doulas have a living wage, and then also as a billing hub to make that easier. And so that our goal is to just streamline the barriers, make straight the path, smooth down the way, so that they can just go and serve the community. That's so important. And then just at the end here, we cited some research and some, varying reports. And so I just wanted to give you a taste. This is not all of it, but just some of the research and information that we referenced. So feel free to check this out, read up on it more, and then also check out our the Community Doula Alliance. Right now it's based on the Portland Doula Training website, but feel free to reach out to us through that. We would love to connect in any way we can to support doulas and make it more sustainable for families to live and have babies and have successful births and postpartums.
And we also say, we are a new nonprofit. So as you all know, when you're starting up a new nonprofit, you need funding. And so we have had a generous donation from a foundation of $100,000. And so our goal by the end of this year is to raise another $150,000. So once you link on to Portland Doula Training, it'll link you onto our rally page. So we are looking to be able to change the birth narrative here in the Portland community. And we feel like we have a really good model and approach to be able to do that. And it also is going to help support BIPOC doulas and also address these inequities and disparities in the community. So we're looking for your support. So if you know someone that can provide a donation, or someone that maybe possibly would like to be on the board, or someone that may can provide any other type of resources. So we're looking for all type of support as we, launch our nonprofit.
Thank you so much for having us. We really appreciate the time.